We described the PK/PD properties of antibiotics used for UTIs, distinguished UTI presentations by symptoms and urinalysis findings, and classified each case as uncomplicated or complicated. Now let's ensure urine cultures are taken in patients with pyelonephritis or recurrent cystitis. It's helpful to think of severity of urinary tract infections. On the one end of the spectrum, we have cystitis, which is less severe, and then more severe than cystitis, we have pyelonephritis, and when that leads to bacteremia, of course, that would be more severe, and then if that leads to sepsis, occasionally referred to as urosepsis, that would be the most severe, putting patients at risk of mortality. Cystitis is a benign infection. It may actually resolve or it may progress to pyelonephritis if untreated. Pyelonephritis is considered a severe infection. It can progress to bacteremia, so therefore we need urine and sometimes blood cultures. So if we anticipate bacteremia, we may need to get blood cultures to assess that in the patients. Sepsis caused by UTIs is a very severe infection, and we need urine culture and blood cultures to assess patients appropriately. And often patients are admitted to the hospital because this is considered an emergency. And in fact, because of the high risk of mortality, it is important for patients to go to the emergency department. Whereas cystitis is very benign and it can be treated outpatients. There is no need for IV antibiotics. And I'm talking about an initial cystitis as opposed to recurrent cystitis, where there is no need for cultures, and it can be treated in the primary care physician's office. And then pyelonephritis is in between, so patients don't necessarily need to go to an emergency department, which is often costly, and there is a high, usually long wait list. So patients can go to an urgent care clinic in order to receive IV antibiotics and receive a urine culture and essentially start their treatment there. So who exactly should get urine cultures? For pyelonephritis, because it is a severe infection and cultures are needed to ensure appropriate therapy. So everybody with pyelonephritis needs urine cultures. And then recurrent cystitis is likely to be due to resistant E. coli or other resistant organisms. So cultures are needed to ensure appropriate therapy is selected in patients with recurrent cystitis. And complicated UTI, which includes pyelonephritis and other infections that go beyond the bladder, is more likely to be due to resistant pathogens, and cultures are needed to ensure appropriate therapy is selected.